G'day. I'm going to now give you a quick rundown on why discs hurt in certain positions. It's really important for someone with a back problem to understand what's going on with the anatomy of their lower back. Once you understand this, you're really empowered to make changes. So this is the shape of a lower back, all right? Most important to just zone in on this space, which is a curve inwards for the lumbar spine. When we see this curve inwards, we're seeing what is a natural distribution of weight from A to Z. The bones and discs are made to align in this position, and so the distribution of weight this way is most efficient. Now when we change this shape, we change everything, and in particular the stress in that disc. It's really important to understand that because a lot of people that have back pain don't understand this, and in doing so never get better. As soon as you get the power of knowledge, you can start changing your back straight away. So what happens when these jelly-filled balloons get pushed together at the front? Just like any balloon, you're going to find that the pressure goes backwards and the stretch in that disc becomes more so at the back. All right? If you can imagine grabbing a balloon and squeezing at the front, the back's going to bulge out. So when we sit or bend forwards, we can see the approximation of these bones pushing together on the discs, which you can't really see on this model. And you can imagine that squeezing all the gel backwards. When that gel squeezes backwards, the fibres in that disc wall will stretch, sometimes beyond their capacity, to a point where maybe that elastic tissue maybe goes past its threshold and tears. When that happens, you've got pain. You can continue to push on that disc every time you sit down or every time you bend forwards, making that pain continue or making that injury unable to heal. So just remember, when you sit, the fronts of your discs get pushed together and the back of them get bulged out. Now this is fine and normal for a normal disc, but once there's an injury, this is an issue. Just like if you cut yourself, you would try and hold it together until it healed, but normal skin you can pull apart, no problems. If you cut yourself and push it together for only a day and then pulled it apart again, it would break. Okay, the same thing with this disc. So you've really got to try and maintain this shape for at least a couple of weeks before you let your guard down. If we have a look at that in side sitting, it looks a little bit like this. All right, so that shape is easily maintained in standing or walking, and mostly people with disc problems will find that those positions are comfortable purely for the fact that it's easy to get in that shape. But when we sit, it's hard to maintain that shape. It's easier just to slouch back. So sitting is often a silent assassin or a silent killer for problems with lower lumbar discs. So try and maintain that nice accentuated lumbar spine curve, particularly if you're in a car. Maybe a rolled up towel might help you. All right, a car makes it hard because as you stretch your leg out, the hamstring pulls your pelvis into a backward tilt, and in doing so makes that back go into a bad shape. So try and minimise your sitting, and if anything, get yourself tilted into a position like that on the edge of your chair maybe, and maybe minimise it to 10 minutes or 20 minutes at a time. If you can stand and sit in that position, once again, you're going to contribute to making that back get better quicker. Hope that helps.